Well, good morning. My name is Dr. Levi Funches. I am an assistant professor of pediatrics with the Department of Pediatrics and then at IU, Indiana University School of Medicine. And so this morning I'm going to talk to you about advocating and partnering in the community with I give an emphasis on fathers to try to address Indiana's infant mortality rate by trying to address one of the bigger preventable causes of it, unsafe sleep practices. My focus is going to be on the importance of role in fathers in helping to address this tenacious issue, but I will touch on safe sleep in general. So quick fact, over 3,500 babies in the US die each year from sleep-related deaths. So what is an infant sleep-related death? It's a sudden and unexpected infant death that happens. The baby's found in their sleep area. The baby had been known to be healthy prior to with no medical issues known. And there's no clear cause of death before investigation. So these are sort of the criteria that meets an infant sleep-related death. Infant sleep-related deaths are the leading cause of death in infants between 1 month and 1 year of age. Some of these deaths are due to SIDS, or sudden infant death syndrome. In Indiana in 2008, a category also called sudden unexpected infant deaths, which SIDS is part of, postnatal accounted for about 38% of infant mortality. So babies who died after a month of age to a year age, we found that sudden unexpected infant deaths was the biggest cause. Along in that, many of these deaths are caused by accidental suffocations or strangulations. And since these are accidents, they are preventable. So many of these deaths can be prevented. And so I'm going to talk to you about ways that practicing safe sleep can help prevent these accidents. Again, I just wanted to emphasize that over 3,500 babies die in the US each year from sleep-related deaths. So we want to attack this issue and do something to save babies. So what do we know? The Back to Sleep campaign has been addressing safe sleep practices for more than 3 decades. We know babies sleep safest on their back. We also know that the sleeping surface matters. Having a firm mattress makes a difference. And every sleep time counts for naps, when they're going to bed at night, to practice safe sleep measures. And it's also to be knowing that who's taking care of these babies also practice safe sleeps, that child care centers, grandparents, because babies who usually sleep on their back, if they get placed on their stomach to sleep, are at a very high risk for sleep-related deaths. And I'll touch on that a little bit later. Babies who sleep on soft beddings are more likely to die from sudden infant death syndromes or suffocations. And so we want to make sure that you have something safe for the baby to sleep on and that you use the proper mattresses. So that's why I mentioned the firm mattress sleeping surface for the babies, because adult mattresses are too soft for them. And something dear to me, fathers and male caregivers are vital partners for a safe sleep, and more importantly, for overall care and development and health for infant and children. And so I really try to emphasize to dads being advocates for this, along with all caregivers, grandparents, mom, but my emphasis is sort of more on dads, trying to advocate for them. We know the benefits of a father in the life of their child is tremendous. Research has shown that engaged fathers play an important role in the healthy development of their children, especially during that time-sensitive period in the first 3 years of life is very crucial. We know the benefits of the father in their child's life. Close relationships fathers have shown with research that those children are twice as likely to enter college. They're half as likely to have experience with depression. They're almost 50% more likely to earn A's in school and 33% less likely to repeat grade levels. So fathers being involved in their child's life is important. Fathers can be powerful allies for their children's health. Early involvement is important. We see that early involvement leads to improved prenatal care during pregnancy. This is vital, especially in those early years. And it also shows continual prenatal care for moms who start in prenatal care early. Dad's involvement, early involvement, have shown to be linked to improved breastfeeding and the benefits of breastfeeding that helps with the development of the child as far as their nutrition as well, and also in fighting infection. And we also see fathers involved in their children's life leads to improved early development and social emotional maturity. So all of these are just some of the benefits that fathers benefit their children's health lives as well. So they're important because engaged fathers in prenatal care are more likely to stay involved throughout the child's life. We see moms who receive prenatal care are 1.5 times more likely to receive prenatal care in the first trimester when fathers are involved. Moms receiving prenatal care in that first trimester is vital for continual prenatal care. And we know the earlier issues are addressed lead to more favorable outcomes for the pregnancy immediately and in the long terms. Fathers are more likely to be the infant's play partner than moms. In those early stages, play is very important to development. And that development for brain development, motor skill development, all of that stimulation that fathers do with their children, playing with them, actually has been linked to improving their development. So dad's play is actually more stimulating and more arousing to infants, studies have shown. We also see that the decisions that dads make every day influence the healthy outcomes of their babies. The decisions you make on employment, the decisions you make on home, the stability of the home, and also decisions that's made on the use or non-use of alcohol or other substances. All these have effect on the child immediately and in the long term. There's also fathers can help mom recognize signs that show when the baby is hungry, which leads to increased breastfeeding. And the benefits, as I mentioned, of breastfeeding helps with fighting infection, neurodevelopment help, as well as help with their vision. And we also know, which I'm talking about, is fathers can be advocates to the mom, to grandparents, to other family members, child caregivers for safe sleep guidance. So just to emphasize to dad, your role is additive to mom, it's not indifference. Because male caregivers are strong allies for child and maternal health. And it's in addition, not indifference or takes over for mom. This is all additive to helping babies achieve their full potential and saving babies' lives. So why are we talking today about this? Because unsafe sleep practices are contributing to infant deaths and affecting infant mortality. Infant mortality is defined as the death of an infant before his or her first birthday. It's also a symbolic benchmarker throughout history of a society's overall health, not just a maternal child health biomarker. It is actually shown to be the #1 indicator of health status in the world. Because if babies are surviving in your society, chances are your society overall is healthy. Currently, Indiana is the 8th worst state for infant mortality rate in the country. We used to be 7th, which we were closer to the bottom. Now we're moving up slowly, and it's continuing to improve because of efforts like what we're doing today and efforts that are being done by organizations throughout the state. Our rate is such that one baby dies about every 14 hours. That sums up to about 1 to 2 babies every day. The rate in the Hoosier state is such that in 2018, 599 babies died before their first birthday. That's about 46 babies every month and about 11 babies every week. And if you look over the last 5 years, that's about 3,000 infants lost. We know this, and we want to do something about this. And helping father and male caregivers become allies will help with this and address this issue. When we look at Indiana's infant mortality rate, we see that Indiana's rate has been about 20 to 25% higher than the nation over the decade. A few years back, there was the 2020 healthy people's goal is getting our infant mortality rate as a nation around 6. So as you can see, the nation has kind of gotten there, but we in Indiana have trailed a little bit. Though we are seeing improvement, we've seen improvements in recent years, even as recent. There's still more data coming in on 2019, but that number has dropped even closer to 6. We still have rooms to improvement, especially when we see that it's not an equal problem. Unfortunately, we see an infant mortality rate for Black babies at about 2 to 2.5 times higher than for other races. This leads us to see that this issue is a diverse and tenacious issue that is going to take a multifaceted approach to address. It's going to be quite involved to try to find a solution, but it's not insurmountable. This slide shows the hardest hit zip codes for infant mortality in Indiana. Data comes in later, so unfortunately I just have up to 2018. Infant mortality is showing that it is influenced by your zip code. We see in the state of Indiana that the areas in the top for high infant mortality rate are focused in some of the same counties. This is helpful because it helps organizations and the state and the Department of Health to focus their efforts and also bring to light the concern for disparities in the state and how we can address those issues. There are many causes for infant mortality rate. It's a diverse problem affected by disparities in care, access to parks, food. For overall causes, we see about 50% of causes are due to birth or perinatal problems. So some things that can't be avoided, unfortunately. But other causes included in that can be assault and injuries, and sudden unexpected infant deaths, or SIDS, which include sleep-related issues. There's also others which include infections. Some of these are modifiable, such as sudden unexpected infant deaths due to unsafe sleep practice. Thus, they have modifiable factors that we can intervene for and have an effect on. Sudden unexpected infant deaths includes SIDS, which people are probably more familiar with, sudden infant death, but also includes accidental suffocations or strangulation in bed, as well as unknown causes. As I mentioned, some of these causes are modifiable, especially the accidental issues, because accidents are preventable. So something can be done to prevent these deaths. When we look at deaths in the state of Indiana for infants, we see that as stated, the majority are due to perinatal causes or birth issues. But about 1 out of 7 in 2018 babies who died from a SIDS event or a sudden unexpected infant death event. So how can we address and help with this? It's going to be a concerted effort from us in healthcare and community partners, and more importantly, those who take care of babies daily, their families, child care centers. And so we want to encourage us all to do our part to help prevent these accidental deaths. Because when we look closer at these, we see that of those SIDS events, the sudden unexpected infant deaths, about 1 out of 3 are due to accidental suffocations and strangulations based on 2018 data. So these accidents can be prevented. So by practicing safe sleep, we can see an effect on these preventable deaths, and we have. As I mentioned, I showed before, we did see that 20 to 25% higher rate than the nation here in Indiana had a higher rate, but we're improving. I've been here since about 2016, and over that course, we've seen a drop of about 9%. And we're projected to actually see even more of a drop with the 2019 data. That data is still rolling in. So effort from the action teams and community and programs like Prevent Child Abuse Indiana to encourage safe sleep practices, as well as uplift fathers and mothers to feel they can advocate for safe sleep, has helped this statistic. And more importantly, it has saved the lives of babies. But we do see the decrease overall along racial groups. We still see that gap, which I mentioned earlier. So we have work to do, because this is a very involved issue that is going to be multifaceted in causes, and it's persistent, and it leads for concern about systemic or pragmatic issues that need to be addressed. And one part is sharing the word and knowledge about safe sleep practices and empowering partners in the community to advocate for safe sleep. And those partners, not just organizations, but individuals, those who are taking care of babies, to practice safe sleep for babies in their community area. So when it comes to safe sleep practices, one thing I like to emphasize to all is that to think of it as simple as your ABCs. So the ABCs of safe sleep, you can remember anything, is remember the A, alone. So babies should sleep not with other people, not with pillows, blankets, or stuffed animals, in their own place where it's just them. Remember the B, placing the baby on their back, not on their stomach or side. The back is the safest place for the baby. And then C, placing the baby in their crib. They should have their own place, not in an adult bed, because our beds are too soft. Not on a sofa, not on a cushion, or any other soft surfaces. They should be in their crib, their own place. When we're talking about safe sleep, we want to talk about the importance that fathers play. That's an emphasis that I like to encourage. I'm doing this work to encourage fathers' involvement because studies shows that dads are vital and they're crucial, and they are a crucial component of their baby's health. And we know they're involved in making decisions. Fathers' involvement in caregiving leads to improved maternal and infant sleep 6 months postpartum, studies have shown. And one thing I emphasize is that male caregivers are more likely to contribute to nighttime waking care. So they are making those critical decisions on the environment that the baby goes back in to sleep in and the position at night, and also at night and nap time as well. Fathers play a vital role in child rearing activities. Breastfeeding, sleep pattern, maternal moods, father involvements help mothers with their education and their career advancement. And we do see an inverse relationship where you see a decrease in infant mortality with increase in maternal education. So we're talking about fathers and them helping with this issue because their involvement matters and it's crucial to addressing this. We can't do it alone, and it's going to take the entire family of caregivers, men and women, to save babies. So now I want to bring up some questions or some thoughts that have come up in other discussions I've had and talks and things you may have been thinking of as well. And hopefully I'll shed some light and clear up some of these points and concern. One question you might be asking is, what my baby choke on their back? With the baby on this side with facing up, or the baby on their belly? Like, would my baby choke on their back? I hope you all know that that's the one we don't want to position the baby. Because one, as I talked about, the B and the ABCs of sleeping, the best place for a baby, position to sleep for a baby, is on their back. But when we talk about the baby choking on their back, actually, if you think about the anatomy, on their back, the part of the baby's airway that goes to their lungs is above the part that goes to their stomach, the tube that feeds to their stomach, the esophagus. So if the baby was to spit up, gravity is going to push things down to its lowest part. And that lowest part is going to be the part that goes to the stomach. So the part going to the lung, the trachea, is protected. However, if a baby is on their stomach, that the airway, the part that goes to the lung, is below the esophagus, the part going to the stomach. So anything they spit up will go back down by gravity to the lowest point. And that's going to be the part, the lungs, the trachea that's leading to the lungs. So it makes it easier for them to aspirate or get food into their lungs. But I also want to point to the bottom of this slide just to remember, coughing doesn't always indicate choking. We cough to clear and protect our airways. It's a reflex. Healthy babies, just like us adults, do it as well. Another question or issue people think about is, does this really work? Does putting babies on their back to sleep really work? Well, before the Back to Sleep campaign kind of started around 1992, more than 8,000 babies were dying each year. Over time, as data accumulated and we started to see around 2000, the number has kind of stabilized around 3,500 deaths each year. Still a high number, still a number. That's why we're doing this work, because we want to get it down to zero. I know that's being probably pretty optimistic of myself, but I want to save all babies. But we do see, if you look over that time, yes, it does work, because it has saved about 80,000 baby lives if you total that difference between 8,000 and 3,500. So the data does show that that campaign does work. Here's another big question. But my mother, grandmother, or best friend put her baby to sleep on his or her stomach, and that baby is fine. You may have heard from your grandparents or your parents saying that they did it to you as well. Well, we know every day new knowledge is gained. We often learn things from the past that we thought were truths were not correct. One example, which I think most people can relate to, is car seats. There used to be a time where infants didn't have to ride in a car seat. But today we know car seats protect children from serious injuries during accidents. And now it's a finable offense, or you get a ticket if an infant does not ride in a car seat. This applies to infant sleep. Research has been done, extensive research has been done and proven that babies are safest when placed on their back to sleep. So we always want to use them on their back to sleep until age 1. I mentioned this earlier about worrying about babies who are used to sleeping on their back being placed on their belly. About 1 in 5 sudden infant deaths occur while the baby is in the care of someone else, data has shown. Often the caregiver has placed the baby on their stomach to sleep. We really worry when a baby who normally sleeps on their back is placed on their stomach to sleep, in what we term unaccustomed tummy sleeping, because their risk is almost a 20 times increased risk of a sleep-related death. That's why it's very important that you, as fathers, mothers, be advocates for placing your baby on their back to sleep. Talk to anyone, the child care providers, grandparents, babysitters, friends, anyone who cares for that baby about safe sleep, because we want your baby to live, and we know that the risk is higher, especially if you've been practicing safe sleep and they go somewhere where they don't. Question people ask, is swaddling safe for my baby? Well, swaddling has not been shown to reduce risk of SIDS, but it is useful for calming fussy babies and for keeping babies on their back. Swaddling must be done correctly to avoid possible hazards, including overheating, face covering, or abnormal hip development. But remember, if the swaddling doesn't affect it, so if you do swaddle your children, you must follow safe sleep practices, putting the baby on their back to sleep if they're swaddled. Prone swaddling has almost a 13 times increased risk of SIDS, and side swaddling has almost a 3 times increased risk of SIDS. So if you swaddle, just because of those concerns that the baby, if they're turning over, starting to roll over, you should stop it as soon as they can, because they could roll themselves over while they're swaddled and increase their risk of sudden infant death. And the best thing, go back for swaddling, is the safe sleep sacks, which are available throughout the state at different locations. So these sacks can be purchased at stores, but they're also given out at some safe sleep locations throughout the state. And that's what we see the babies here on this image in. I listed on this slide some of the safe sleep locations. I know that's kind of maybe hard to see, but on the next slide, I put the link for the website, and you can also call the Indiana State Department of Health and mention your county, and they can tell you what's nearest to you, where you can go and get access to a safe sleep sack, and even some pack and plays for, like, if you are to travel, to make sure your baby has somewhere safe to sleep. Why is it dangerous for my baby to sleep in an adult bed? Well, one, the baby may become wedged between the wall and the mattress, which has happened. These are images of a toy, so these aren't real babies. And as I mentioned, there's a lot of soft things in our bed. Our mattresses are soft, the comforters are soft, the big pillows, these things are soft, and they could cause the baby to suffocate. So that's the big reason why them not sleeping in your bed. It's not the best for the baby. Why our pillows and positioners are dangerous, as seen in these images on these dolls. Baby could get caught face down, and our pillows are soft, and so they could wrap around the baby's face and lead to suffocation. as well as things could dislodge and get over on the baby's face as seen in the other images. So these things, they're too soft, they're too loose, and they're dangerous. Half of the infants in the US who die of sleep-related deaths are found sleeping with their parents. That's why it's vital that babies have a place where they can sleep alone. And that's why I emphasize the A in the ABCs of sleep, a place dedicated only for them. The Indiana State Department of Health cares about this and is trying to ensure every family has somewhere for their baby to sleep safely by themselves. So please use the resource that I listed earlier to contact the resource facilities to get safe sleep supplies for your baby if needed. Something else you might thought of is, I know I shouldn't sleep with my baby, but he or she is fussy. What can I do? Well, one thing put out is like using the 5 S's. So one, swaddling. Swaddling helps. A lot of these suggestions, the 5 S's, are things that kind of reminds the baby of being in the womb. Swaddling provides warmth and security the same way as the baby felt when they were inside mom. Shushing and swinging. So shushing, making the shushing noise, imitates the noise in the womb. Makes the baby feel calm and safe. And it works best when done loudly. Swinging, also rocking the baby in your arms or using the infant swing, kind of reminds them of being inside the womb and the movements they felt. So those things help. Sometimes, especially if a baby seems fussy after eating, side or stomach positioning them while they're awake or holding the baby on their left side to help with digestion helps. But it's key, definitely, once they're asleep, you make sure that baby, when they're put in the crib, that they're on their back and not on their side, only when they're awake, holding them that way. Suckling helps as well. It's natural for babies to enjoy sucking on pacifier, even when they're not hungry. And so that can help them sometimes. Other techniques, a soothing bath or an infant massage may also help quiet your baby. And one thing that really suggests, and I've kind of known my own experience, is taking the baby to a quiet area, just changing the environment where the baby's at and fussy. Sometimes can help relax a fussy baby. So efforts are complex, but not insurmountable. Things to do to try to address this issue. We can make a difference by all working together and speaking up for our babies. As I mentioned, in 2018, we had 599 infants in Indiana died before their first birthday. That number's a little bit less in 2017, and I'm hoping it'll be less here in 2019, but still too many. We want to get it lower and to 0. Nearly 14% of those deaths were due to sudden unexpected infant deaths, which accidental suffocation or strangulations do fall under that category. And that's why we're emphasizing trying to do things to prevent that and address modifiable things such as unsafe sleep practices. And the disparities we see are indicators that make this prevention efforts tough and complex. Not insurmountable, but it's something that's taken a lot of effort to investigate and try to get down to causes of why it's happening. So I'll just emphasize, remember the ABCs of safe sleep. A for alone, B for placing the baby only on their back to sleep, and C for crib, the safest place for the baby to sleep, not in a toddler bed or child bed, an adult bed, a sofa or cushion. So with that, I thank you all for listening to me, and thank you for being and seeking ways that you can help babies sleep safely and make it to celebrate their first birthday. Thank you.